Let's talk about the difference between phobic anxiety disorder, panic disorder, and generalized anxiety disorder. So first starting with the phobic anxiety disorder or phobia. Usually, phobia is a fear of a situation which the patient fears so much that he always tries to avoid. So what are the parts? The patient has a fear. The cognition. The cognition of the patient is a fear. The fear of what? Fear of a specific situation. And as this patient has the fear, this patient tries to avoid the situation. So the cognition is the fear, and the behavior that the patient shows is the avoidance of that specific situation. And whenever we take the patient into that situation, to that specific situation that the patient fears, then the patient will have symptoms. So the patient will have symptom on exposure to that fearful situation. So that is a situational symptomatic patient. The symptoms will present on exposure to that specific situation. That is phobic anxiety disorder. A classic example might be a fear of height, acrophobia. So the patient avoids any high-rise building, especially going to the top floor. If you take the patient blindfolded to the top floor and take out the cloth, then the patient will have a panic attack. The patient will have severe fear, severe anxiety. That is a phobic anxiety disorder. Next comes the panic disorder. In this panic disorder, the patient fears the attacks. Patient oftentimes has attacks without any underlying cause, without any specific association with any situation, but the patient has those attacks. So the cognition is the fear of attacks, fear of the symptoms of panic attacks. And the behavior is escaping whenever they have any clues that this patient is going to have those symptoms or he is having those symptoms, he tries to escape the situation where the symptoms are occurring. So the behavior is the escape behavior, escaping from the situation where the attacks are going on. And the symptoms usually are paroxysmal because we don't know when the attack will be going on or when the attack will start. Maybe it starts inside the house. Maybe it starts in a plane. Maybe it starts in the hospital. You never know where the attacks will start. The last one is the generalized anxiety disorder. This is where the patient has a constant worry. The cognition is a constant worry. And the behavior is patient is always irritated and agitated, always irritated and always agitated. And what's the symptom? The symptoms are the worry and agitation. So those are persistent. Those are persistent symptoms. The symptoms occurs continuously. It goes on and on and on, usually for more than 6 months.